Mass protests across the United States have deepened concerns about a possible second wave of the coronavirus. At least 2 members of the U.S. National Guard have tested positive for the virus after assisting police officers during protests in the state of Nebraska. The head of the World Health Organization said he supports protesters, but they should take precautions.
We encourage all those protesting around the world to do so safely. As much as possible, keep at least 1 meter from others. Clean your hands, cover your cough, and wear a mask.
Here in New York, the state's top official encouraged protesters to get tested.
If you were at a protest, I understand your point, I'm with you. We also have the situation with the coronavirus. Act responsibly, get a test.
In New York City, hundreds of thousands of people gathered to protest the death of George Floyd. Cuomo says, as of this week, 15 sites will test protesters free of charge.
I would act as if you were exposed, and I would tell people who I'm interacting with, assume I am positive for the virus.
At a protest on Sunday, some who participated agreed on the importance of testing.
Everyone should get themselves tested so they could know how else to protect the other family member, because they might have family members that are immune system that are suppressed. So in order to protect them better, they should get tested.
Health experts say protests are particularly risky because it's hard to practice social distancing. The chanting and screaming can also further spread droplets of the virus, and the use of tear gas and other police tactics can facilitate the spread. That's why some lawmakers are asking to ban the use of tear gas during the pandemic. Despite the risks, many aren't deterred from hitting the streets.
At this protest in New York City, you'll see stethoscopes and scrubs. It was organized by healthcare workers, people who know more than anyone the risks of COVID-19. But many of them said while they are concerned about a second wave, they felt it was worth coming out today.
And as a physician who's seen many people die from the coronavirus, and am truly scared about a second wave, I still think this is the right thing to do. Wear a mask, get out there, have a voice.
The protests calling for racial justice also support many of the patients these doctors and nurses have been caring for. African Americans represent 13% of the U.S. population, but 24% of COVID-19 deaths.
COVID, yes, is very dangerous, but all the injustice that's happening with Black African Americans, it's just as dangerous. So we have to be out here. It's not really a choice at this point.
Racism and systemic racism is itself kind of a virus in our system. And, I think for me, I've felt that if there's anything to come out for, it would be this.
Karina Huber, CGTN, New York.